Welcome, Hawaii Preparatory Academy, Ohana, families, friends, and guests. Thank you for joining us online. My name is James Hustace, HPA class of 2003, and I will be your moderator for our COVID-19 vaccine information session. How are we doing? All right. Looks like we're all connected here. And now we're being live streamed. So aloha kako, everyone. Welcome to Hawaii Preparatory Academy, Ohana family and friends, and our guests. Thank you for joining us online. My name is James Hustace, HPA class of 2003, and I'll be your moderator for our COVID-19 vaccine information session this evening. And during this session, we hope to provide you and your families the information and assurances that you seek as you consider the COVID-19 vaccine for your keiki, for your children. We are grateful to be joined by 3 Waimea doctors and lead representatives from Hawaii Preparatory Academy to share with you and your families information about the COVID-19 vaccines available, their efficacy and their safety. Our speakers this evening include Dr. Dworkin, the infectious disease specialist at Queens North Hawaii Community Hospital, Dr. Pulling, pediatrician at Paniolo Pediatrics and Family Medicine, and Dr. Kurap, family medicine physician at Kīpuka, Okeola Native Hawaiian Rural Health Clinic. And our interim head of school, Fred Wawner. Also on the call this evening, we have members of the HPA Safety Committee, Amanda Bamba, registered nurse and the Director of Health Services, and Mark Noetzel, the Dean of Campus Life. And assisting the technology piece, we have the HPA Marketing Communications team, led by Mileka Lincoln, class of 2002, who's a Director of Marketing Communications, and Jared DeGroot, the Digital Communications Manager. After hearing from our speakers this evening, we'll be spending some time answering questions that you might have. Mahalo for those who had previously submitted questions for tonight's forum. If you have questions during this information session, please use the Zoom Q&A feature to submit your inquiry. We will also monitor the YouTube chat for other questions that may arise. We hope that tonight's forum will help guide your decision-making for your family. So to start things off, I would first like to welcome in the interim head of school, Fred Wawner, to share a few words and provide us with some overall safety goals for Hawaii Preparatory Academy going forward. Welcome, Fred, and thank you for having me facilitate for tonight's program.
Thank you, James. We really appreciate you. Aloha, friends at HPA. Thank you for joining us. Today, we are so grateful for our community health leaders, Dr. Pulling, Dr. Dworkin, and Dr. Kurap, taking time out of their busy schedules to share their experience and wisdom with us. HPA's goal in hosting this event is to give medical information to our community with the intention of raising our vaccination rates here at school and thus in our local community. Our mission of providing exceptional learning opportunities in a diverse community, honoring the traditions of Hawaii, relies on our health and safety plans now more than ever. We know in order to deliver on our mission in the best way possible, we want to be face-to-face and be able to offer all of our many programming options. We are at our best when we have co-curricular programs, place-based excursions, and student activities. Students' ability to engage in these activities will ultimately be compromised if they are eligible and choose not to get vaccinated. We believe COVID-19 is a medical issue that requires us to follow the lead of medical experts. We're following the lead of the Department of Health and the CDC, who identify these key strategies for layered risk mitigation. Vaccination is critical and categorized as a core essential strategy. We do not have enough eligible students with documented vaccinations at this time. We estimate that we will begin the school year with only 60 to 70% community immunity in our eligible student population. We have a long way to go and hope today's information will allay any fears and misinformation. While vaccination is our primary tool, we will continue to layer mitigation strategies throughout each area of school life. Some of these are daily wellness checks, increased ventilation in our learning spaces, masking indoors, masking outdoors when not distancing, screening tests prior to the beginning of school. Thank you folks who came out today or are coming out tomorrow. And then surveillance testing once we get students here on campus. A key determining factor to our success in delivering on our mission will be the prevalence of vaccinations within our HPA community. We have work to do. We need our families to continue to send in their paperwork as we still have too many outstanding forms. We're working hard to message the need for vaccination while also holding vaccination clinics on campus. We appreciate the doctors who are on this call and about to share their wisdom. Thank you very much.
Mahalo, Fred. Thank you for your leadership of our HPA families, faculty, and staff, and the larger community during this challenging time. Appreciate you. Mahalo. Now I'd like to welcome in our Waimea doctors for the next portion of the call here. So first to join us will be Dr. Jonathan Dworkin, once again, the infectious disease specialist at Queens North Hawaiʻi Community Hospital, to touch on the current impacts of our healthcare system, how the vaccines work, with a comparison between mRNA and previous generation vaccines, and then also vaccine safety. Welcome, Dr. Dworkin.
Thank you. Thanks for having me. And I want to commend the school for putting this together and for being so responsive to the public health needs of the community. Well, I think the best way for me to do this is just to cut to the chase. I'm an infectious disease consultant. I work primarily at Queens North Hawaiʻi in Waimea. Prior to that, I worked for a number of years at Punch Bowl in Honolulu, and I was doing the back and forth and decided that this island is the best island to be on. So I've been here exclusively now for the last year. And it's been a wonderful place to practice until the last couple of weeks in which we've become a sort of apocalyptic movie set in the hospital. And I'll just share with you some of what's going on. We're being deluged now with cases of viral pneumonia all times a day. And many of these people are coming into the emergency room extremely contagious and sick at home, some with oxygen. The sicker ones we're admitting, and they're now taking up about half the admissions to the hospital, or COVID admissions. I've been rounding on a couple of times in the ICU in the last week, where 3 of our 4 ICU beds were COVID patients. We're no longer able to get assistance from Queens Punch Bowl because they're also being swamped with, and their hospitalizations are almost as high as the peak last fall and winter, which means we're very much on our own now for medical care until that situation changes. We're continuing to see non-COVID cases, of course. People are coming in with all the usual medical problems, heart attacks, strokes, non-COVID infections of various kinds. But because we're being stretched so thin in terms of beds and staffing, we juggle all these balls and provide people with the best care possible. So we are strained right now, and I'm very proud of the team that we have at Queens North Hawaiʻi. I think it's performing brilliantly. Everybody's been very professional, and we're doing our best to maintain a high level of service for the community. But it's very tough. And I have to be honest, I was expecting a variant wave in the spring. I knew that this wasn't over just because we began vaccinating. We knew that most of the world had not been vaccinated and that we would see some form of variant emerge. But I have been taken by surprise by how vicious it's been. It's extremely contagious. It's much more contagious than COVID was last year. And the result is that it's just ripping through the population of this island now. The vast majority of the admissions to the hospital are unvaccinated people. It's about 90%. And I checked with my colleagues in Honolulu, and they're seeing the same thing. So 90% of these people coming in with viral pneumonia are unvaccinated. And the rest tend to be people who are kind of frail and who maybe didn't get the best response to the vaccine because they had other medical problems going on. But this is what we're seeing. And once people get admitted with the viral pneumonia, the kinds of interventions that I can provide as an infectious disease specialist to turn around that disease process are very unsatisfying. We use a number of drugs, all of which are far more toxic than the vaccine, to try to reverse the illness, and none of which work nearly as well as the vaccine. So it's somewhat shocking to me that people get hung up on the vaccine, but then are perfectly happy to have all those very aggressive and intrusive interventions done on them once they're admitted to the hospital, none of which work very well. So that's the situation, and I wish I could give better news, but that's where we are. And I promised my colleagues that I would beseech people to help us. I think if we got our vaccination rates significantly higher, if we got to 80 or 90%, if we could do that as a community in the next month, we would ride out this wave and we would still see COVID. I don't think we could completely knock it out. It's so contagious that we would still see clusters, but we wouldn't be seeing our healthcare system overwhelmed in this way. And that makes all the difference in the world in terms of the amount of maiming and destruction and mayhem that we're going to be left with. So that's the situation with the hospital. The vaccine, I saw there were some questions submitted, and maybe I'll save some time for the others so that I can answer those questions. It is a different type of vaccine, the mRNA vaccine. It's not totally new like people think it is. The idea for mRNA vaccination actually goes back to the 1990s. It's an old idea. And there were trials done with vaccines for mRNA vaccines earlier, years ago, that just didn't work very well. So this is the first one that's been used widely. But we do have experience with it going back years. And I'm convinced it's a very safe vaccine. I'm going to allow some of my co-panelists to talk about it, particularly in children. But my whole family's been vaccinated. And I can tell you from talking to the clinic people and from experience in the hospital, we are not seeing anybody come into the hospital with vaccination side effects. And we've given thousands and thousands of vaccines. And we've had maybe one or two people that we needed to monitor for allergic reactions. In contrast, we've had just been deluged with unvaccinated COVID pneumonia. So that's the state of things. And I'm going to turn it over to my co-panelists. Thank you.
Mahalo, Dr. Dworkin. Appreciate your time and being on the call with us here. So next up, I would like to welcome Dr. Melissa Pulling, who's a pediatrician at Paniolo Pediatrics and Family Medicine, to really continue this conversation about the ongoing impacts to our hospitals, our healthcare system, also talking about vaccine safety for our children, and sometimes issues concerning FDA approval. So welcome, Dr. Pulling. Thank you for your time.
Thank you. Thank you, Dr. Dworkin. That was a great talk. And thank you, HPA. We've really been fortunate to have such a great past year. And hopefully we can get our vaccination rates up. Quite frankly, I'm more worried about this year for school than I was last year. And I'm guessing the administration is also. Anyway, I'm a pediatrician at Paniolo Pediatrics. I've been on the island now for 4 years. I moved from the San Francisco Bay Area, and I'm very happy to live on the Big Island. So I'm going to talk about the COVID vaccine, which is approved for children ages 12 and older. That's the Pfizer vaccine. It's the only one at this point that's approved for the children ages 12 to 17. It's incredibly safe and effective. Pediatricians throughout Hawaii and the United States, as well as the American Academy of Pediatrics, recommend the vaccine for all children 12 and up, since the vaccine is much safer than the risk of an actual COVID infection in kids. Since mid-July, close to 9 million children have received the Pfizer vaccine. Serious adverse side effects, which Dr. Dworkin talked about, are very rare. That would really be anaphylaxis. And that's really the only reason why we would give a medical exemption if there was a severe anaphylaxis or severe allergy. The biggest worry I hear from parents is their concern about myocarditis or inflammation of the heart from the vaccine. Fortunately, this is a very rare risk and it's mild. The symptoms are temporary and they resolve without treatment. Most importantly, myocarditis is much more likely after an actual COVID-19 illness. The second most common concern I hear is that the vaccine is too new and we don't know about the long-term side effects in our keiki. The good news is we've now given billions of doses of the vaccine worldwide, and we also have about 1.5 years of data from the earliest study participants. As we've learned from all the routine vaccines we give to children, like the chickenpox vaccine or the polio vaccine, side effects occur within the first 6 weeks of receiving a vaccine. And this is true for the Pfizer vaccine as well. So given all the evidence, I am not worried about long-term side effects, and I try to relay that message to the families I see in the office. Earlier in the spring, some parents were concerned about the harms of future fertility. I haven't had that question in quite a while, probably my last question of that was probably back in May. I believe most parents know this claim is baseless and it's not supported by the experts. It is important to remember the health risks from the COVID virus itself far outweigh the side effects of the vaccine. So I encourage all families to talk with their doctors to get the facts and ask their questions. You know, in regard to what pediatricians are seeing in the office, we've had a very lucky year this past year on the Big Island, and definitely in terms of children, we just were not seeing much COVID on this island. Unfortunately, in the past month, we've been seeing a big surge in pediatric cases here in Hawaii, as well as in the entire United States. In Hawaii now, about 20 to 25% of the cases are in children. And because children under 12 are not able to be vaccinated, we're seeing a large increase because the Delta variant, which is what is mostly on our island now, is extremely contagious. We're seeing more of our keiki hospitalized, and many of our pediatric hospitals and ICUs across the country are overwhelmed, as Dr. Dworkin was telling us about our own hospital here in Waimea. The good news is kids remain, as they have throughout the pandemic, a much lower risk of getting seriously sick, especially compared to unvaccinated adults. The number one thing I tell families they can do to protect their keiki is to get everyone in the households 12 and older vaccinated. In regard to waiting for FDA approval, I recommend, and as do all my fellow pediatricians in the American Academy of Pediatrics, that you get vaccinated now if you're eligible, if you're 12 and up. The COVID-19 vaccines are emergency use authorized at this time. However, this doesn't mean the vaccines are experimental. Billions of doses have now been given across the world, and we know the COVID vaccines are extremely safe as well as effective. The FDA follows a very rigorous process to ensure vaccine safety and effectiveness in an emergency like the COVID pandemic. And in regard to the Pfizer vaccine, they have submitted 6 months of data, and full approval is expected within the next few weeks. However, again, nobody should wait for FDA approval. I did get my own children vaccinated when the vaccine was first approved for teens. That made them much more comfortable interacting with their friends and going to school. Is a big sigh of relief for them. As a pediatrician and a parent, I know the best place for kids to be in terms of their emotional and mental well-being, as well as their development, is in school. And that's why I am a big advocate for our school community of HPA getting as many of our 12 and ups vaccinated as we can. Thanks.
Mahalo, Dr. Pulling. Appreciate that. Thank you. Let's see. I think we did not lose him, I hope. Oh, there he is. All right.
Yeah, sorry, just shut off for a second, but I'm back on.
No problem. All right. So next up is Dr. John Kurap. He's a family medicine physician at Kīpuka, Okeola Native Hawaiian Rural Health Clinic, to really further touch on community impacts and also the current state of COVID-19 as in regards to the Delta variant and how vaccines play a role in our continued effort here. So welcome, Dr. Kurap. Thank you for joining us.
Thank you very much. And I appreciate you guys doing this and giving us the opportunity to hopefully encourage more people to get vaccinated. So, you know, I'd love to see these rates go up. I've been on Big Island for 9 years. I'm originally from Detroit area and did residency at Duke and undergrad at University of Michigan, but have loved spending time here. And I've got 2 daughters, 9 and 6, and I would most certainly get them vaccinated if I'm able, you know, if we are able to drop these rates down to lower ages. So real quick, some interesting stuff that just came out just yesterday. You can go to New England Journal of Medicine, effectiveness of COVID-19 vaccines against the Delta variant. This is out in the last day. So pretty interesting stuff. I'll go over this a little bit, But mainly what I wanted to express is the questions I've been hearing recently from people about people's concerns about the vaccine in relation to Delta variant, and why is this more severe in some ways. And so we've probably all seen pictures of the virus in different forms, and this is just a cute little one kind of expressing the severity of this in a worse way. It's this spike protein that's on the outside of the virus that our bodies are trying to adapt and build antibodies against. And what happens is, with this one in particular, it doesn't seem like we have as great of an ability to create antibodies or recognize that spike protein. So it's able to kind of circulate in the body longer. And I was explaining to some of the staff today that just like in the advent of HIV, we had to fight HIV in a number of different ways. And the severity of HIV was based on the viral load in the body. So how much of that virus is doing damage internally. And if you have one little HIV virus, one little COVID virus inside the body, it's not going to do as much damage as if it's able to replicate and really do damage to all organs. So the severity of this is based on our body's ability to kind of recognize the virus right off the bat and start forming some way to fight it. And the more that it can replicate and create different versions of itself, do more damage throughout the body. So that's kind of the reason why I going back to Dr. Dworkin's comments about the different types of vaccines, I was explaining to someone else that, when you have a football team, you can't have just linebackers on defense. You have to have different positions. And so just like different vaccines, they attack the virus, or different vaccines or different antivirals or antibiotics, they attack things differently. And that's to try to hit things from a lot of different perspectives and really knock down the load of how much damage something can do within the body. But just real quick, going over just this research paper. This was done in the UK, taking people who had been vaccinated with the Pfizer and Moderna vaccine, and the relation between how effective the vaccine was against both the Alpha and Delta variants. And I had heard questions from people in the community saying, well, I heard doesn't help the virus. I heard it's not effective. And basically the drop in effectiveness between the Alpha and Delta variant was from 93% effective down to 88% effective. So it's not a significant drop. It certainly is effective. It's very effective. But what they found was the difference between effectiveness of one vaccine versus getting the second vaccine is very important as well. So it's not just that you can get the one vaccine and then take every plane flight without a mask and just think that you're going to be fine. You still have to take these precautions, and so that's important to remember. Again, it was a study with 39,000 participants or so. So these are worthwhile studies to look at, and so it is important to read the data. It is important to question statistics that you're hearing on the news and everywhere else, and always look at that from a kind of a global mindset of what are they trying to teach us in general. So as far as what I'm hearing in the clinic, I was kind of disappointed or saddened, I guess, early on when we started offering the potential for vaccinations, how many people in our community 75 and older were not interested in getting the vaccine. And this was probably from just things that they had heard. And then there was a whole segment of the population that really, really wanted to get it and dove in right away and were really eager, even if they were, below 75, really contacting us to try to get vaccinated much earlier. In the last couple of weeks, I have had a number of positive patients, and I see patients from Hilo side to Captain Cook all over, and a lot of patients that were not vaccinated, and they were coming in whole families that were positive, and it's sad. It's because we can do something about it, and the only way to really keep knocking this down, and the only way for our kids to continue going to school and going to see HPA football games and everything else is to get people vaccinated and so they're not getting sick. So I'm happy to stay on and answer questions, but that's a little bit of the background and a little bit of the research paper that's been going on recently about it. So thank you very much.
Mahalo, Dr. Kurap. Thank you so much. And mahalo to all of our doctors, Dr. Pulling, Dr. Dworkin, Dr. Kurap, once again, for spending time with us this evening. to address concerns and share your knowledge with the HPA Ohana. And so at this time, we'd like to take about the next 15 minutes here or so to address some viewer questions. Thank you again to those of you who have submitted questions in previously. Please use the Zoom Q&A feature to submit any new questions. We will do our best to address as many questions as possible in the next bit of time that we have here. All right, so to start things off, and we're going to kind of mix it up here a little bit. So we have a couple questions for our doctors, as well as some of our HPA staff and employees here. And some of these we may have covered already. So like we mentioned before, some of these we're going to recap a couple things, and it's okay to share back and rehash some of these things, just so we get this information across here. All right, so I'll really open up to anyone who can jump in on the call here. But the question reads, do we know when vaccines might be available for children under the age of 12?
I'm happy to answer that one. Dr. Dworkin might want to add a little bit to my answer, but we're looking at the first age group being the children ages 5 to 11 for the Pfizer vaccine. We're anticipating fall to early winter for that age group. Pfizer plans to submit their data to the FDA by the end of September. And then the FDA will analyze the safety data and decide if it will grant authorization. So are very hopeful that will be coming in the next couple months, but I can't give you an exact date. For the group next youngest, that's the 2 to 4 year olds, that should be following right after that. And then 6 months to 2 years would be the next age group. And we're hoping for early 2022 for both of those groups.
Yeah, thanks for clarifying that. The only thing I would add is that when we're talking about vaccination in children, we all agree that it has to be very, very safe in children. So you need to get large numbers, and you need to be able to pin down exactly what the safety profile is. And because COVID, at least 2020 COVID, was a relatively mild disease in children, I don't want to overemphasize how mild it was. We still had hundreds of children die from COVID in the United States. But because it was not as bad as it was in adults, we really need the safety data. And I think they did the right thing in enrolling more children in these studies so that we could really pin that down. For a vaccine to be used in children, it has to be good for each individual child you use it in. In other words, the benefit of the vaccine has to outweigh any potential risk in that child. You don't vaccinate children in order to protect adults. So that's sort of the baseline ethic, I think, behind what they're doing, which is they're trying to get more kids enrolled so that they can really pin down these safety issues. When they ran that analysis for adults, I'm sorry, not for adults, but for adolescents in that 12 to 17 age group, there's an excellent document that was put together by the ACIP, which you can Google, ACIP vaccination for COVID in adolescents, where they actually break down the risk benefit for each age group, and then they gender specify for men and women. And they get into some of the side effects that have been described, like the very rare myocarditis cases, one in tens of thousands, versus the risk of actually having natural infection with COVID. And that's why vaccinating adolescents is such a no-brainer in my mind. I read through that document. You can see the data, it's all there. The benefit clearly is there. So I'm waiting for a similar analysis with the younger kids.
Thank you, Dr. Dworkin and Dr. Pulling. This kind of question comes up often about, I've had COVID before, I was tested positive. Now that I have some natural immunity, why should I get vaccinated?
I'm happy to take it either way. And I was thinking about this from a variety of different perspectives. I do, Kamomi, Pagadawan and myself are the medical team that assists with the HPA borders. But I also do urgent care oftentimes in town here. And when I'm doing urgent care on the weekends around the holidays, about 2 weeks after Christmas and New Year's holidays, when all the tourists have come through, is when we all start getting sick, because this, other variant of what we don't normally commonly see here comes on an island. And it's the same thing with flu and everything else, is that you may get flu 1 year, but flu changes bit by bit each year, and you may even get the flu vaccine and still come down with some illness. And so it's the same way that this thing is going to be around for a long time. And it's for those reasons that you should protect yourself in as many ways as possible. And when, as I said before, when there's different types of vaccines that attack this in different ways, it's wise to have all those resources on hand. You're having had it, certainly your body's building a response, but you want to boost that response in any way you can.
And to follow up on that, if people are testing positive for COVID-19 and they've been vaccinated, why should I go out and get vaccinated?
Yeah, there's a lot of confusion over the vaccine and what it does against Delta variant specifically. So when the vaccine first came out, it was matched very precisely to the strain that was circulating in 2020, the original Wuhan strain. And it was an extremely effective vaccine, surprisingly effective, actually. It not only prevented severe illness, but it also was extremely effective at blocking transmission. So we just saw the epidemic, melt away in well-vaccinated countries in the early part of this year. Because we weren't able to get that vaccine out around the world, we're now suffering these waves of variants that are coming from places that didn't get vaccinated at all. The Delta variant originally arose in India, which was under-vaccinated when it arose. So that uncontrolled transmission amongst a billion people led to the rising of this variant. And it doesn't precisely match the vaccine. So what we're finding is that the vaccine is extremely effective still at preventing severe illness, but it may be a little bit less effective at preventing mild illness and transmission. So what I'm seeing as an infectious disease doctor is I'm seeing vaccinated patients get infected on occasion, and they tend to have head colds. These tend to be people who had Delta variant COVID breathe in their face, and they get a little respiratory infection brewing in the nose. And then around day 3, day 4, because they have memory B cells, they have memory T cells, they begin churning out antibody that is effective. They don't come in with the viral pneumonia. They get the head cold. But during those first few days, they may be contagious. So ultimately, we may need, if there's more variants that arise, a booster that is tailored to the variant that arises to restore the 100% or close to 100% transmission blockade that we were enjoying earlier in the year. But we still see that I do think it is still at least partly blocking transmission because the vast majority of people testing positive are unvaccinated. And it's certainly effective in keeping people out of the hospital. So, not being perfect doesn't mean that it doesn't work. It just means that the situation has changed. And when you're in a boxing match with a virus, you can't stay still. You've got to be able to adjust to what's going on.
Just to reiterate what Dr. Dworkin said, 99% of the COVID-19 deaths are in the unvaccinated in our country. So unvaccinated people are much more likely to both require hospitalization, but they're also the ones who are dying from COVID-19 right now in our country as well.
Thank you, Dr. Pulling, for adding that in there. Absolutely. And another question, are you concerned that there is no long-term data on this vaccine or the vaccines in general?
I sort of answered that when I spoke before in terms of all vaccines. We really don't worry so much about long-term effects from vaccines because we just have never seen that before. The effects of vaccines are really within the first 6 weeks. So that's not something that I worry about or other doctors worry about or the American Academy of Pediatrics. It's really the effects that we see right away, like anaphylaxis, that would be a serious side effect of a COVID vaccine or of any vaccine.
I think Dr. Pulling really addressed that very well when she first spoke. And we now have the experience of having given, hundreds of millions of doses of this vaccine and observed it over a year, which is a very good basis of evidence to have confidence. There's also our basic understanding of the biology of mRNA, and also there's the 200-year history of vaccination in this country. So, what I'm seeing with the but you can't rule out a long-term effect kinds of claims, and there's a flavor of propaganda circulating on the internet, which I think is very clever that pushes this. And I found one paper, if I could just give one quick example, that looked very slick. It looked like an actual medical paper, and I had to look it up later and realized that it was not an actual medical paper. It was in a fake journal. But what it claimed was that the coronavirus might cause, a disease that only takes 30 years to arise. And this is what we call a non-falsifiable claim. So in order to prove that guy wrong, I would have to wait 30 years at whatever we're at now, 600 deaths a day, in order to establish that that's an erroneous claim. But if you look at the references and if you look at what he was basing his assertion on, it was very thin. So people are throwing a lot of garbage at the wall and hoping something will stick. And I just hope people are alert to that. And it would be very unprecedented for something like this to arise after hundreds of millions of doses and more than a year of experience. So I'm not worried about that for the reasons Dr. Pulling mentioned.
Thank you. Another question is, are we rushing to inoculate without the proper data on the effects of our youth? So are we concerned that we're really pushing this for our keiki? Are we concerned that there might be any long-term effects for our children? Do you have any thoughts on that?
Again, I'm not worried about the long-term effects in our keiki. Just like with all the vaccines we've been giving for 200 years now, we just haven't seen any long-term effects, and the science backing these vaccines is very solid. The data is incredible. We've already vaccinated 9 million, almost 9 million of our 12 to 17-year-olds, and billions of vaccine doses have been given now in the world. So I think that's pretty solid evidence.
The other thing is people don't seem sufficiently worried about the long-term effects of getting COVID. And when you get an mRNA vaccine, your deltoid muscle is producing spike protein, and then you produce an antibody response against the spike protein, and that makes people very upset. But what happens when you get COVID? Your body is filled with spike protein. That's what a COVID infection. That's what a SARS-CoV-2 infection is. But it's not just the spike protein; it's all the other proteins that virus has evolved to demonstrate. And what I'm seeing in the hospital is absolutely horrible immune-mediated responses to natural infection. That's what the acute respiratory failure is. It happens around day 8, day 9, day 10. It is an autoimmune response to the infection, and not just to the spike protein, but to all the other proteins. And we think that may also be playing a role in the long COVID symptoms that we're seeing with people who suffer long-term illness. So the nice thing about vaccination is it's sort of a laser beam focused at the spike protein that then protects you from the worst impact of the disease. And the worst impact of the disease is this dysregulated immune response, which then causes multi-organ failure and makes people very sick. So I think the concern about the vaccine should be matched with an even greater concern with what happens when you're getting the 5 or 6 different proteins that the virus is putting into you with uncontrolled replication.
Thank you, Dr. Dworkin and Dr. Pulling. I wanted to ask a question to our HPA staff as well, if you don't mind. So this question is about current percentage, if you could share the current percentage of fully vaccinated or those students that are eligible to be vaccinated for our first days of class beginning this year.
Sure. So, one of our challenges is data collection. So we're still chasing out some things. And then we also have a known population of students who didn't have access to vaccination. So this will be the first time that they have access. And so that'll be on Wednesday. We'll have a vaccination clinic here on campus. But as I mentioned, we estimate we'll probably start school with between 60 to 70% vaccination rate with the eligible students. And another reason or a main reason that we're engaging in this conversation now, because we set a goal in June to get to 90%, and it seemed very conservative at the time, and clearly now, we need to get there. And there's conversations around Why wait to mandate? We certainly have rumbled with that. And quite frankly, we didn't feel like we were in a position to mandate in August based on, we knew we have to engage in this work in our community. We feel like our families, we want to respect their abilities to choose their own path, but we hope it ultimately aligns with our entire HPA community, which is, in order to have everyone vaccinated. We also, we realized that the FDA approval is something that was very important to people. And so we're hopeful that that'll take place in the coming month because we understand that the importance for some folks. And so we're still trying to develop a clear picture on some of our data, and that'll take a bit. So if you're on this call and you haven't sent in your forms to let us know if your child's been vaccinated or if you're ready to be vaccinated on Wednesday, we need that information. So there's a lot of work to still be done, but we estimate probably 60 to 70%.
Thank you, Fred. Would you be able to expand on the goal you set of 90%, why you targeted for 90% vaccination rate?
Sure.
Yeah,
Mandy,
yeah, no problem. I can take that. So I know that it's really basic science that we know that the more infectious a disease is, the more people you need to have immunized in order to, or have a higher community immunity rate in order to protect those that either can't be vaccinated and are vulnerable populations that don't, elicit that strong immune response from a vaccine. And so it may seem really daunting to get 90% in our total United States population of 320 million people. But we're talking about a really small, relatively small boarding school here on the Big Island, boarding and day population. And I don't think that 90% is unattainable. And I think that we can do it with things like these vaccine information sessions, and having people talk to their physicians and really educating people on that. And I think we can get there. I think that we just need to really get people on board to understand why it's so important to do.
Thank you, Amanda. And then could you also share, either you or Fred, talk about why are you waiting until October 1st to put in this mandate for vaccinations?
Sure, thanks, James. I mean, I kind of tried to explain, we just didn't feel like we were in a position to mandate it right now. And we're a bit of a different vessel in terms of some of the other schools, in that we have a known subset of students that don't have not had access to the vaccine. So we need to onboard them. We definitely have families that want their students vaccinated, but haven't been able to do so. And then we also want to continue to hold information sessions for folks that are kind of on the fence or are misinformed or maybe just scared. And so we know our school community, and we didn't feel like we were ready to mandate it, but there's going to come a time where we've got to get our numbers up, and if mandating is the only way, then that we're prepared to do that, and that's why we put it out there to August 1st. The other reason is that once we want to start our vaccinations on Wednesday, we wanted to give time for obviously students to go through that process.
Thank you, Fred. And I'd like to bring one more question back to our doctors on the call, and this is really talking about masks. Is there a certain mask that is recommended based on the estimated community immunity rate of about 60 to 70% of our HPA's eligible population?
I'd be curious to hear what my co-panelists say about that. My understanding with masks is that the loose-fitting cloth mask in general, I would say better the mask is the one we should use, but the loose-fitting cloth masks are less effective than a well-fit mask. So I don't know, Dr. Pulling or Dr. Kurap, do you have any specific recommendations on masks for kids?
Yeah, it's a little trickier with kids because obviously the size of their face is smaller, so it has to fit their face. So for adults, in a medical setting, Dr. Dworkin wears an N95 mask, and Dr. Kurap and I do as well. So that's not feasible for children, of course. and they're not very comfortable. And then there's also these KN95 masks. That's something I wear like on a plane or when I go to the grocery store. It's a little better protection. And then we have the disposable surgical masks. They do make these for children. Actually, that's what my kids wore last year. It's not the best for the environment, of course, because they are disposable, but they're really the best for a kid's full day at school where they've been running around and exercising. They just throw it away because nobody's really washing their masks. We've realized that's too hard to do. So that's what I would recommend is the kid-sized surgical masks. Yeah, there you go.
Thank you, doctor.
This is what I use for my girls, and this or the other masks that are basically, again, you're right, because a cloth one that they're gonna leave in the car and then want to put on again, that's not any healthier. So it's something that they can just use and then toss. That's what I give my girls.
Thank you, doctors. Appreciate that. Well, mahalo nui. We're really grateful for the contributions and desire to learn more here. We really apologize if we're unable to reach your question. We're kind of reaching that time here this evening. But if you do have further questions about school policy, please be sure to contact Hawaiʻi Preparatory staff at safety@hpa.edu. And if you have any additional medical or health concerns or questions, please do reach out to your healthcare provider. So as we kind of start wrapping things up here, I'd really like to welcome back in Mr. Fred Wawner to really offer a couple of tidbits of information and share a few words with us as we look to the school year ahead. Welcome, Fred.
Thanks, James. Doctors on the call, we're so grateful for all the information. Thank you so much. And you're really, really important to our community. So we appreciate you. And then HPA families and friends, I just want to honor and respect that this is a really, really challenging time. And we sit in no judgment of you and the decisions you're making. We do have to follow a path, and we're going to follow our medical advice with the CDC, the doctors on this call, the Department of Health, to have the safest experience we can to try to deliver our mission for your students. So, you know, it's challenging. There's a lot of different opinions. There's a lot of different information. We want your students to get vaccinated. We want our staff to get vaccinated. We want to have the safest environment we can. So we appreciate you and understand that, you know, there's differences of opinion in this. And so we want to just treat each other, follow our core values and treat each other with aloha as we you know, navigate this challenging time. So thank you everyone for joining this call, and especially doctors and James for being an amazing moderator. We appreciate you.
Mahalo nui, Fred. Thank you so much. And so as we close tonight, I'd like to once again thank Dr. Dworkin, Dr. Pulling, Dr. Kurap for taking the time to be with us here and for helping to improve our understanding of COVID-19 vaccines, and not to mention our current situation. Mahalo, of course, to Fred, Amanda, Mark, and the Marcom team for putting on this forum, and for really connecting with HPA Ohana in this virtual setting. And thank you, of course, to the HPA families and friends for joining us. A recording of this meeting will be made available for you to revisit. Stay safe, everyone, and have a nice evening. Aloha.